Assalamu alaikum.
Good evening, everyone, and thank you very much for joining us for Academic Dialogue in Hargeysa Africa 1440 webinar series, where we have been covering and still covering impacts and related issues about the COVID pandemic. Tonight, we are going to have our 10th episode, which is going to be focusing on the psychological impact of the pandemic, mainly focusing on the continent, but globally too. For this, as usual, we have two main speakers and two respondents, along with our moderator for the night. Our speaker for the night is going to be Assistant Professor Ephraim Habte from Jijjiga University. He is an assistant professor of counseling psychology at the School of Psychology in Jijjiga University. He is a current director of guidance and counseling directorate at this university, and he has served more than 10 years with different experience in teaching psychology and in different research, including mental health. Currently, he is working with a team on a research assessing the psychological well-being during the COVID pandemic, where we hope to hear a few points from this ongoing research tonight. So thank you very much, Ephraim. And the second main speaker for the night is going to be Dr. Liban Ahmed Hersi, who is a psychiatric and clinical psychologist who has studied integrated clinical and community mental health. He has also studied positive psychotherapy from International Academy of Positive and Transcultural Psychotherapy. He is the manager and founder of his medical center here in Hargeysa. He has served in various positions in government or voluntary-based activities with his field of study. So these two will be our main speakers for the night. And as a respondent, we have tonight Dr. Mukhtar and Dr. Maryam. Dr. Mukhtar Bashir Ahmed is a licensed senior mental health specialist who also have studied integrated clinical and community mental health. He is currently also the director of Gabile Mental Hospital, located in Gabile, Somaliland. As a clinician, he has served to see over more than 3,000 cases with diverse clinical mental disorders, including children. So he will be our respondent. The first respondent is going to be Dr. Maryam Mohammed Hajrabi, who is a medical doctor, currently working with Health Poverty Action as a clinical coordinator. She has been involved in community health since her medical school. She has obtained her BA degree in medical surgery from Hargeysa University, and she has worked as a resident doctor at Edna Aden Hospital here in Somaliland, where she also has done her graduate diploma in maternal and infant health. She has worked as a King Somaliland Partnership Mental Health representative. She has teaching experience, volunteer experience, and she is actually one of the Yali alumni in Somaliland. So these two are going to be our respondents. So our moderator for the night is going to be Kadan Muse, who is a successful Abarso graduate, which is a famous very contributing school in Somaliland, and she has been volunteer after school community services starting 2010. She was awarded a Mastercard Foundation scholarship in New York, where she has studied psychology. And in 2019, when she returned home, she has helped to establish Kaba Barsos inspired school system. So these are going to be the panelists that we're going to have for the night to talk about the psychological impact of COVID. Once again, I want to say thank you very much for the panelists and everyone who has joined us in the Zoom webinar as an attendant. And also we are live streaming this on our Facebook account. So thank you very much for everyone who's joining us. And Kadan, I'll pass it to you to do your moderation. Thank you.
Thank you so much, Thursday, for the introductions. Our opening questions for tonight's discussion are three main questions. And the first question is, how has COVID-19 impacted the psychological well-being of communities in Africa? That's our first question. The second, how is the continent responding to the challenges? Third, what is the way forward to address these challenges? So these are our 3 guiding questions for tonight. And I would like to welcome Dr. Jama for our scene set. Dr. Jama.
Thank you so much, Qadan, and it's a pleasure to have a wonderful panelists who have expertise on the issues, important issues that we are dealing today. In this 10 episode of our webinar, those who are in the morning, good morning, good evening, good afternoon. I know that we have followers from all over the world. As a pandemic was unexpected. And as everything that's unexpected, with the fear of unknown and uncertainty, of course, what we would expect is that it has a psychological and psychological aspect impact of all sectors of the society. But then what we realize when you look at closely, you feel that this has more impact in certain specific sectors of the society. And what I am hoping today is to see not only at the local level what's happening in Somaliland or in Ethiopia or in Eastern Africa bloc, but to see if we can extend this to the African continent and see widely what has the similarities and what has the differences of the questions that Qadan asked us. And those questions and reflect on how the continent is entirely responding. I think similarities in the African continent for the first time would be so close to, with many other aspects, it has always differentiated the 54 countries or 55 countries of the continent. So what we hope to see is that, for example, the most difficult aspect of the pandemic was the issue of the stay at home. Then, because that was what created, at least in the northern bloc or northern part of the world, what created the problem is the psychological aspect of the home, people who had to stay with solitude, staying at home. It's not happening in Thailand, for example, and most African countries didn't have that kind of problem, which means there has never been a full stay at home where people remain solitude. But at the same time, if you look at closely to Somaliland, with the schools closing, what happened was with the children staying at home and the mothers who were working in the informal sector of the production, there was a huge problem in the meaning of that women, mainly mothers, should have to go out alone, leaving alone the children at home. So that created a huge psychological aspect of the home and the household. So the difference, despite that we have a different attitude towards the concept of stay at I sincerely apologize because of my internet is not working well. I hope you are hearing me now again. So just to conclude, despite the similarities that we can mention, still we want to see also the differences of the single countries, or at least the blocks of everyone agree that Africa in general was reacting and responding to the coronavirus better than many other other countries. There is might be some reasons that we can raise even tonight because of every discussion that we had that was coming up. So I would conclude that I think that two major issues: one, stay at home, but in a different aspect, is with the children staying at home, and economic impact, which created anxiety and problems with the families, how people are responding on that, how African continent is responding collectively on that. And with that, I give back Qadan to the microphone. Thank you. And I apologize again for the internet continuity that I may have in the future.
Thank you so much, Dr. Chama, and to all of our speakers and all the participants who are joining us or already joined. So to call on our first speaker is Dr. Ephraim. While we wait on for Dr. Ephraim to respond, would like to thank all of our other participants and other moderators, other guest speakers. And it looks like they have some technical difficulties, but Dr. Liban, I think now we can call on Dr. Liban to join. Dr. Liban, I think you're muted.
I think now you hear me well. Yeah, firstly, I thank all the panelists, including Dr. Chama Musa, and who is the director of Hargeysa Cultural Center, and Dr. Mukhtar, Dr. Mariam, and Dr. Qadan, who is the facilitator, and Dr. Ephraim. First of all, thank you for inviting me this very valuable discussion about the impact that COVID-19 could have on the community, the psychological impact especially. And so if we start on some background about this COVID-19, it was, I think, January 21 when WHO first announced that there is a pandemic of COVID-19. And in Somaliland, the first 2 cases was found on March 21. And later on, the government responded by creating National COVID-19 Response and Prevention Committee, which has made assessment throughout all the regions of the country and how they have did how the people are taking the messages, how they are responding to COVID-19. And after that, the people were having fear about contracting this illness. They were having anxiety. They were facing a lot of difficulties, psychological difficulties, which were not addressed well. Since now, although the government released the restrictions on June, maybe mid-June, still there is fear that the virus didn't went out. Still, it's there, and it is fears and anxiety still goes on. So if we go how this crisis or how this epidemic or pandemic is affecting psychologically, is that whenever there is something called disaster, which could be natural disaster or man-made disaster like wars, the psychology of the community is affected severely, because there's stressful situations. The people are getting into in a stressful situation. And if we define what is that stress means when the pressure and the challenges that the people are facing is more than the capacities, so that the resources you have cannot match, and you cannot confront or you cannot overcome these challenges. And when it comes to this COVID-19 pandemic, it was something natural disaster, which is worldwide, globally, and everybody was having his own contemplations and fears about contracting and how the world will become, about unemployment. It was affecting in many dimensions. So many people were having stressful situations. And when the person became stressed, there are some symptoms which most of the people do not know. But to clarify that there is stress, and we can say when the person is having stress, he's having what's called physical symptoms, emotional symptoms, cognitive symptoms, what's called psychological symptoms. We can divide into 5 different sectors: physical, emotional, behavioral, cognitive, and social. For example, when the person is having stress from the physical, and he's having body aches, pains, headaches, stomach aches, and fatigue. All these signs, symptoms are from the body, which is caused by stress. But the people might think that there is medical disease, and they may go to different medical physicians. They don't go to psychologists to get counseled. And from the emotional side, there is feelings of fear, anger, anxiety, sadness, that which is associated with the stressful situations that the people are having. And from behavioral sector, we could say that the people became avoiding from contracting the COVID-19. They're staying inside, their behavior will change. They became refusing to the guidelines and the restrictions that the government impose. Some of them go to addictions for self-treatment. Some of them may have failure and towards and praying or spirituality. So, from cognitive wise, when the person is very stressful, he became indecisive. His thinking became distorted. He cannot think clearly. He became confused, misunderstanding, inability to solve problems. And from social perspective of stress symptoms, there is increased conflicts among interpersonal conflicts. There is hostility towards others, conflicts associated with the neighbors and with peers and with family members. So when there is stress caused by anything like the pandemic, COVID-19 pandemic, it is affecting in multiple dimensions, from the person to the community, even to the country. So if it's not addressed well and not included in the prevention and response actions, the longer consequences of these stressful situations will be very much high, and it will go into mental disorders like depression, OCD, schizophrenia, and many other severe psychological disorders, which could be prevented earlier if it is addressed well. So there are general tips that we are sending a message to the community, so that they could reduce this stressful situation in the pandemic period. So we are saying people, be happy, sleep well, eat well, and you have to have a balanced lifestyle, pray well, be positive all the time, simplify informations and take the good ones, socialize well, get right information from there is a lot of information and traumas and misconceptions in the media. So you have to get selections about how to get the right information. You have to get enough exercise. You have to engage with families and make schedules. And you have to take time to relax so that the stressful situation is may reduce. And also, there is another way that we can help to those who are feeling very much stressed from COVID-19. There's what's called psychological first aid, which everybody, non-professional people can do, which is just to calm down when the person is very stressed. When the person is very stressed, there are steps that people can help each other. It's first to make safe, make secure that there is no harm happening to the person, make hope, link to our network, making to agencies which will provide more needs like psychological support. And lastly, we are not forgetting to make recommendations to the government and to international NGOs and local NGOs to include their interventionists, what's called mental health and psychosocial support as part of their intervention project is to be streamlined to every actions they are taking so that people will be aware and get prepared from the effects of the psychological impact of the COVID-19. And thank you very much.
Thank you so much, Dr. Liban, and to all our participants who are joining us or already here. Please, you can send us any questions you have. Dr. Ephraim, now we'll hear from Dr. Ephraim. Can Dr. Ephraim hear us?
All right, thank you very much. First of all, I'm very much thankful to Hargeysa Cultural Center to be a part of this academic dialogue. I have been given a very short time so that I will try to make my point very much specific and so that I may try to address the points which were pointed out in the beginning of this discussion. So, in the broader aspect of viral outbreak, it is impossible to accurately predict mortality and morbidity rates, which will be caused by the newly emerged pathogenic virus, which is agreed by international scholars. The other is, as you all know, WHO, World Health Organization, declared that COVID-19 is a pandemic. Since then, the virus is affecting virtually every person in every country across the globe, bringing negative economic, social, physical, spiritual crisis, psychological crisis. I do personally agree, as it was agreed by scholars across the globe, that viral outbreak may affect both human and animals without imposing any extensive fatalities. But, however, the psychological impact is very much immense and strong upon human beings. That's why nowadays coronavirus is becoming a very challenge to psychological resilience, which is being faced by individuals across the globe. Now, I have a concern. Actually, which I will be trying to point out later on. What is being done? What are the global scenarios, measures taken by internationally recognized organizations and bodies? For example, in history of mankind, for the first time in Wuhan, the city underwent through medical quarantine. Many vaccines and drugs trial with all its political conspiracies. And again, state emergencies were declared in different countries, in Africa, in developing countries, in developed world, sanctions, banning public gathering, closing the schools and marketplaces, and announcing to work, telling every employees in the organization to take over the tasks by being in their home. Medical facilities disseminated throughout the world with help of different humanitarian services and basically World Health Organization. My point is, when you go through the detail, all the measures taken by World Health Organization and other concerned organizations regarding the problem related with COVID-19, I can personally, which is agreed by most scholars, mental health aspect has been given a little emphasis. What has been frequently mentioned with this organization is a physical aspect of an individual, the economic aspect of a community, a society, an individual, and other related factors. There is no intensive research work plan, a strategy program disseminated throughout the world, which can possibly address the mental, the psychological aspect of individuals, the mindset of the community, the mindset of individuals regarding adjusting themselves to properly deal with this problem. Before I go directly to the psychological impact of COVID-19, there is pointers, which is a part of my interest. Why we are linking COVID-19 specific to the psychological problem that can be imposed upon every individual. The first is there were extreme government measures being taken. And the other is the stigma behind being tested for positive for coronavirus. Nowadays, the question is, the question people ask is not how am I going to be tested positive, rather than what would happen if I tested positive. Thinking of stigma, discrimination, support from the family, support from the community, support from the religious institutions, and so on. This is all the point that people bring to their mind the moment they are thinking of being tested positive for coronavirus. The other is there will be decreased family support, increased access to food, access to alcohol, access to game and gambling, prolonged exposure to internet and digital instruments. This could possibly contribute to the negativity of individual mental health. The other is, if you see in particularly the scenario of developed world, the developing country, Africa, Latin America in particular, Eastern Africa, our life is, the platform of our life is group life. We enjoy collective culture, shared value. Cultural ties were compromised as a result of coronavirus. Group religious practice was compromised as a result of the outbreak of this virus. That's why we are linking specifically COVID-19 with this kind of imposition of psychological effect. What I'm trying to say is, unlike other viruses, coronavirus can play a very vital role in changing the mindset of an individual and exposing them, uh, uh, exposing exposing them to experience some sort of distress, constant of being infected, symptom of anxiety, depression, insomnia, avoidance behavior, because of the sanctions imposed by the government without a particular protocol. For example, if you see most of African countries, there was a state of emergency specific to social distancing, home self-quarantine, without a specific protocol, keeping one's mind safe, without specific orientation as how a person can keep his mind clean. Frustration, obsessive thoughts, and obsessive behavior regarding personal hygiene, and so on. These are attributing factors that a person could possibly be experiencing as a result of coronavirus. Anyways, my concern and the point which I really want to be addressed is the moment coronavirus is correlated or linked with psychological impact is what should be done in the future. I am more interested bringing up an idea regarding what shall be done starting from onwards rather than what has been done so far. So this is my expertise insight regarding what should be done in the upcoming time. I'm addressing the government, the global community in general, and specifically I'm addressing the community and individual in particular. So addressing the government, these are my points. Contextualized psychological crisis intervention model has to be implemented. Contextualized psychological crisis intervention has to be implemented, which can fit the African socio-economic context. Psychological crisis intervention model that can be implemented in line with our own culture, the culture we have been living by. The other is culture-sensitive mental health modalities has to be programs especially designed to COVID-19 related distresses are very much important. The way we communicate African people regarding COVID has to be different. The way how we communicate European, Americans, and Asian people. So we need to have contextually defined modalities. How can we address people in Africa, in Ethiopia, in Somalia, so that the community can develop well-equipped mindset to keep themselves to be clean from any distressful information and unwanted information. Continuous research based on scientific standard has to be followed. There has to be a standard, and so that scholars, international universities, organizations may conduct continuously and address the problem specifically. The other is worst case scenario has to be re-evaluated. Countries throughout the world come up with their own worst case scenario. What will happen if coronavirus continues this way? The plan, the program, the intervention strategy has to be re-evaluated. The worst case scenario designed across Europe cannot be fully implemented and cannot be go parallelly with the context of Africa. So there should be time has to be given to concerned government body organization, and so that they may check the worst case scenario that can fit the African context. The other is pre-existing psychiatric illness has to be considered. COVID-19 can impose psychological problem, and there are individuals with pre-existing psychological illnesses. All the measurement in the plan should be considerate of this thing. Proper follow-up and early recognition of indigenous knowledge is very important. Positive measures has to be continued. Paradoxical irony quoted by most scholars: home quarantine for homeless. This time, street children, people with severe psychological problems along the street are forbidden, forgotten. Home quarantine. How about the scenario of homeless people? Scholars are mentioning this scenario as paradoxical irony. All the plan, program, globally, a program which is designed to address global problems should be considerate of individuals alongside of the streets. Female street children, elderly, aged people, adults has to be considered. And the other is professional in this regard need to have a global mindset regarding mental health treatment, and so that we can easily entertain our local problems. So if you have information regarding what is going on internationally, what is going on in different continents, and so that we can develop a program that can fit our own culture. Regarding community and individuals, maybe the community must not refer a patient as a victim or a diseased one, because the term by itself imposes negative psychological. The other is people, individuals, need to minimize watching, reading, listening information in news, which can possibly terrorize and make them be anxious or distressed. The other is the community and the individual. The community in general, individuals in particular, need to follow all the standards listed by WHO so that they can easily prevent and feel healthy. The other one is lack of adherence. If you see what is happening this time, and remember, 4 months back, 5 months back, everyone in every country has been terrorized, thinking of coronavirus, sanitizing oneself, using face masks, talking about how can they possibly be protected and be prevented from this contamination. Nowadays, everything is forgotten. Things are going to the paradox. 4 months back, 5 months back, the government is attentively following the community, following individuals, organizations, effectively implementing WHO measures, but now the reverse is going. So this is a time that every concerned body, individuals and government need to take things into consideration and be conscious, and so that they need to recap the community so that they can protect themselves. This is what I have for now. Maybe in the midst of the discussion, I may probably bring some ideas. And thank you very much for listening.
Sorry guys, I had the lost connection there, but thank you so much, Dr. Ephraim and Dr. Liban. And to generally recap, we have all heard from both our panelists in terms of how coronavirus has impacted people globally, locally, and even individually. And if you have any questions regarding to any of the topics they have covered, please let us know your questions. And now we can call on our one of our other participants, Dr. Panelist, Dr. Miriam.
Yes.
Dr. Miriam, can you hear us?
Yeah, I can hear you. I probably see that you can hear me.
Yeah, we can.
So thank you for having me in this interview. And by responding to Dr. Ephraim, that he stated that he had been talk about the effects and the psychological impact and economical stats that COVID-19 lead us to. But when we are talking about the current challenge brought by COVID-19 to the psychological impact after this pandemic crisis, and if we divide it into the two levels, that like in third world, it's among the world places, among the places of the world is able to cope with COVID-19 because of the numerous forms of factors like poverty-related problems, because of the low levels access to healthcare, and limited stats of capacity. And because of that, globally, and we found that there's a psychological and problems and important consequence effects, such as that has been mentioned, such as stress, frustration, anxiety, depression, and uncertainty COVID-19 outbreak that emerged progressively. And according that, as the doctors have been mentioning, there's a symptoms related and symptoms that you can find those who have stress-related problems, like they have both physical and emotional symptoms that can be emerged. So, and in order to find out and statistically, there is, according to the research conducted by Transparency Solutions with the collaboration of University of Bristol, that have been took part that research, it states that among 1/3 of the participants, they mentioned, they reported that they worry about their mental health or that of the family. So that mentions that there's worry that's related to it. So if we found out differently of according to the continent, according to the different countries' diplomatic status, it depends. Because of that, and I found the reasons behind is because of worrying being affected of COVID-19, worrying being stigmatized, or worrying to be excluded from your community or from your society, as we already know that our community is dependent on the society. And other important thing can lead to because of the loss of income or because of being forced to be quarantined. Or sometimes it happens people are worried being because of the poor health facility standards. So in addition to that, the modern world, they are individuals that are able to rapidly or easily travel to the other countries and communicate easily. Because of that, it has been fairly forced because of the social isolation, and it has been restricted. And actually, COVID-19 is a traumatic event, and it's needed because of the sometimes and media took part a crucial point because they tend to spread the negative or bad news, and because of that, people found it frustrated or fear that they can be affected. Some people isolate themselves because they fear if they go to the market, they might be infected or they might be brought the virus to the home and the family. So that's why they worry about their loved ones. So if you found that and think about how we can cope up or come up with a solutions or coping mechanism of COVID-19, the psychological impact that has been led by it. So we can think about and important thing, the people should be stay connected, or sometimes because you need to communicate your family or friends. And especially important point that I would like to address is not to be ashamed to expose what you are feeling or what you are going through. And secondly, it should be limited access to the media because of we found that negative spirit led the people to spread about this increasing mortality rates and found that the spirit threatened it, and everyone should be carried on his or her own regular daily activity. The other things that have been mentioned is to be established regular routine like doing normal exercise or doing a balanced lifestyle, and then socialize with the community or your friends through only social communication channels by phone or any social media. The other things that have been discussed is because of we already know that COVID-19 led to psychological impact, but what about prevention measures that the government can take part? It's because of we can add our prevention measures. The people should be aware about their mental health. There's existing previously mental health that the people already have it, and in order to address that and also to prevent this coming fear and anxiety or people being stressed, it should be added about prevention missions. And that's the important thing to find out that and the rule of awareness will be make a difference. The other things, if the people is found that this is really psychological impact of COVID-19 is real, so people, when they found that it's out of control or they found the physical symptoms, they should have to seek help or find professional for help. And the thing I would like to address more is that the globally now they found that this is after pandemic crisis of coronavirus that's been declared by WHO. They found that the consequence effect, short-term or even long-term effect, will be mental health. And so that's the reason my message will be that everyone should be look that the necessity that the people look after your mental health, of course, as important as you are looking for your physical health. So that's how I would like to conclude my session, and thank you for having me.
Thank you so much, Dr. Miriam. And now I would like to hear from Dr. Mukhtar, his response.
Thank you. Thank you, Dr. Jama Musa Jama, Director of Hargeysa Cultural Center, for hosting this impressive webinar meeting. And I would like to thank the speakers and respondents as well as facilitators. This is actually, I'm glad to be part of this webinar meeting. And I would like to, you have raised very important points. The panelists, speakers, as well as Dr. Mariam, you have raised very important points that I do have in mind. But I would like to add very important few points. It is obvious that COVID-19 has impacted, has caused from mild stressors to mild stress reactions to the extent of anxiety, depression, fear, and phobia, and to the extent of severe mental disorder symptoms, like symptoms of psychotic disorders. So the impact of COVID-19 ranged from mild stress reactions to severe psychotic symptoms like delusion of having COVID-19 infection. And then we have, you have discussed an important point about dimensions of impact of COVID-19. To summarize those important points, then psychological impact like anxiety, depression, fear of contracting infection, fear of uncertainty of COVID-19 or the consequence of infection, as well as worry about contracting COVID-19, which is personal, and then worry about your families, your partners, and children at home, is also psychological dimension or aspect of COVID-19 impact. And then fear of losing family members, fear of losing partners and children, as well as fear of losing loved ones in the family, were psychological impact. And then we do have another side, the social one that you have already mentioned, and Dr. Ephraim and Dr. Liban has, and as well as Dr. Mariam, you have explained well about stigma. The stigma, according to the most recent literature's latest publications about COVID-19 impact, there were stigma towards people who have contracted COVID-19. Not only stigma towards patients with COVID-19, but there was also a kind of self-stigma in which the individuals stigmatize themselves. The way they perceive people, other people see them, has an impact on the personal well-being of an individual. In other sense, in other way, there is also anticipation stigma, in which people who do not have COVID-19, who are taking care of people who do have COVID-19, specifically frontline healthcare workers, medical professionals, psychologists, psychiatrists, or medical professionals who are taking care of people who do have COVID-19, they had anticipation stigma, before they even had COVID-19. So they were thinking about, if I have contracted COVID-19, what will be the significance? So how will people see me? So the range of stigma towards COVID-19 is very wide. Exclusion as well as isolation, and grief and loss, reaction to loss, which we do call grief. How do we help people during grief? How do we say goodbye to when we lose a loved one in the family is really different from Western societies, as well as in East Africa. We do have a very intimate relationship with our family members as well as with relatives. Even if he do have COVID or she do have COVID-19, people want to take care of people to the end stage of their lives. So, and the way the people bury people, the way they do say goodbye to their loved ones is really different during COVID-19 pandemic. And this is the same for Ethiopia, Kenya, or East African countries. So there is abnormal grief, and people are very worried about than losing people in their family. They were very much worried about how do they bury their loved ones or family members who have contracted COVID-19 or who died due to COVID-19. Another way, there was also pressure from partners and peer pressure or partner pressure. And there were clinicians or healthcare professionals who had reached to the extent of choosing helping people with COVID-19 as a frontline workers, and they have been obliged between choosing taking care of working at emergency settings of COVID-19 and having their partners or they're living with their families. And there were a pressure from even families. So I would like to share with you a scenario here in Gibile. There were a family who came from Djibouti, which is our neighbor country, and they rented a house from Gibile. And then after some weeks, as I have heard, one of their child had tested positive for COVID-19. And then his father asked him to leave the house immediately. And then he was a young adolescent. Then he went to nearby rural town to live with the partners and then to isolate himself. And then immediately by the night, the elders had a meeting, and then they asked him to leave the area before sunrise, before the morning. So, and then he returned back to Gibile, and then this scenario has reached to the government stakeholders. Still, the government stakeholders, specifically mayors, as well as director of emergency unit in Gibile, they have responded well, and then they have kept this case, even if he was asymptomatic. Then they have helped him to stay in the emergency unit for only isolation. So this is specifically how do we exclude and how do we see people with COVID-19. Even the family members, they will isolate or exclude from their own families. So this is clear. And then people with anxiety and depression, the situation has worsened. People with obsessive compulsive disorder, yes, we are telling them to wash their hands frequently. But people with obsessive thoughts of fear of being contaminated or intrusive thoughts, they had worsened symptoms of OCD. So this is similar with, as a clinician, I have seen many cases who had symptoms of obsessive compulsive disorder during COVID-19 pandemic. And in general, as a continent globally, people has focused on how to take care of people who will be affected by COVID-19. So as individual, as community, as well as a continent, as a country, we have been focused on more of the physical aspect, the medical aspect of COVID-19 in terms of materials, medical equipment, supplies, ventilators, oxygen, personal protective equipments, hand washing facilities. This was not only governmental organizations, but also non-governmental organizations were rushing to distribute those personal protective equipment, hand washing facilities, and so on. Despite the psychological and the social impact of COVID-19 has ignored. And I would like to focus on those points, and my recommendation will be towards the government. This is natural disaster. This is an infection. This is pandemic issue, and we don't have to forget this physical, as we have well managed and thought about the medical aspect of COVID-19. We have to also think about the social, the psychological, the emotional approach of COVID-19 should be there. So we are very late in having even this discussion. And even this, our today's webinar meeting would have been arranged before 3 to 4 months so that we can focus on preventive measures. Now, it seems the COVID-19 infection impact is decreasing over time gradually, specifically in these our East African countries. So now we have to think about the consequences. Yes, so as to work on preventive measures, community awareness, disseminating right information, focusing on personal well-being, psychological first aid training for all professionals, including healthcare professionals specifically. So this is my recommendations, and thank you very much.
Thank you so much, Dr. Mukhtar, and all the other panelists. And now we're moving towards the discussion session, where our attendees can send us their questions, and if they're directed towards the specific people, then those specific people can answer. And if anyone else has anything to add to that question, it might not have been directed to you, but you can always answer or add any thoughts you have. Our first question comes from Yahya Yusuf and is directed to Dr. Liban and Dr. Miriam. It goes, most Somaliland citizens are employed by international organizations, and during COVID-19, most staffs suddenly lost their jobs. So what kind of psychological impact was left on them? And that's directed towards Dr. Liban and Dr. Miriam again.
Yeah, and if I apologize for having some technical problem and during Dr. Mariam's talk, and I apologize missing that part. If I return to the question of Yahya, and it's very much important question to be asked. There are a lot of consequences about this pandemic that we will deal in as a whole, globally or locally. Many people employed will lose jobs, okay, and there will be stigma and discrimination about the survivors of those who contracted the virus. The other consequences would be that as Horn of Africa people, we are social people, and that means social isolation and decrease of social networking will impact to the psychological well-being of our societies. And the most important thing is that when the person is having an unemployment, is having stress. And if that stress, if he internalize and do not have discussion on social support and networks, and this stress will make him worse. So, firstly, is two parties. What the person can do is to have, in order to reduce his stressful situation, is he have to care himself. He have to balance his life so that his thinking and his emotions would be settled. And the other thing is to have social networks so that he can find another source of job that he can overcome these stressful situations. And so there are lots of long-term and short-term consequences that we will deal with. And we have to be prepared about the psychological part of this post-COVID-19 pandemic as a whole, individually, family, community, and also government and intergovernment and collaboration is needed in order to deal with this issue. And thank you very much.
Would you like to add anything?
Yeah, I'm so glad that Dr. Liban clarified clearly the unemployment, how can be lead. And so thankful that Yahya has defined this point, because we already know and the consequence effect this pandemic crisis lead to be unemployment, because a lot of organization and company has reduced their employment and because in order to cope. And really this is the major consequence effect to lead psychological impact, because those who lost their jobs, they might be dependent on their daily life income, and that income might be run or support their families. And because of this low income, and there's no other supporters that might be help them because of this. And unemployment might be lead to the poverty, and which we already know poverty-related problems might be lead to people to put in a pressure and to be stressed and be frustrated. And because of reasons is that people who weren't able to have, they may be lead to the financial difficulty, and that financial difficulty, they might be lost, or they couldn't be able to put a food on the table. They couldn't able to feed their family or their relatives. And that might be lead people to lead them and economical barriers. And because we already know unemployment, that people weren't able to access the healthcare facilities or to go to the healthcare facilities. Other important things, because even after the coronavirus crisis, as a pandemic is going to be reducing globally, but there is a difficulty to find job again, because we already know there's a lot of percentage that statistically come out that they couldn't able to find job or couldn't able to return their normal daily life activity. And for sure, and that people who are adapted to be employed, they might be found and themselves that they might be become weak. They couldn't able to handle their life, or they couldn't able to do their normal daily life activity to fund the family or support their families. And because of that, and it has been declined that, and after COVID-19 crisis ends, the major and important or difficulty that the world will raise or face it will be an economical barrier and unemployment. So in order to summarize what we have been saying is, firstly, they may be lead to the poverty-related problems, and for sure they put themselves in pressure and they become stressed about their solution. And if that's not been supported by any government or local or international organization or external support, they couldn't find, they maybe put them in other further way difficulty. So that's why I would like to see or come out and recommend the government to come up with solutions. Those who have lost those who lost their jobs, to come up any alternative way that they can be back to their normal life. So yeah, thank you.
Thank you, Dr. Liban and Dr. Miriam, for answering that, and Yahya for sending in your questions. Here we have another question from Yahya as well. he states that the divorce rate has increased during the pandemic, especially in Africa. So even families are psychologically affected. So is there any remedies for that? And this is directed towards Professor Ephraim and Dr. Ephraim.
Huda, would you restate the questions, please? I'm not clear with the statement, with the question. Would you bring me back the question?
Yeah, of course. It states that the divorce rate has increased during the pandemic, especially in the continent, like in Africa. So even families are psychologically affected. So is there any remedies? That's from Yahya Yusuf.
Thank you very much. Actually, this is the serious issue which we have been observing this time. Divorce rate is increasing in alarming rate in developing countries. Even if you observe the scenario in Ethiopia, the divorce rate is increasing from time to time, and it is being escalating in this particular COVID time. There are a number of issues that come along with this issue when we're thinking of the solution. The first is the most of I can say husbands in Ethiopia, they not clearly understand taking time with their family. They consider themselves as a provider. Taking time with the family and kids is underestimated. So, from my experience, this is the point at which I'm thinking of a solution. Concerned body, government, and any non-government organization working with this issue need to develop a standard, so that we can have a prolonged, sustaining solution. Every members of the family, especially the husband and the wife, will develop a culture of taking time, spending time with their kids. The moment COVID outbreak is pronounced, people are obliged to stay home. The more they stay home, that is the experience. I mean, that is the thing that people do not experience so far. So, what I'm thinking as a sustaining solution is we need to have a platform and which can accommodate family problem, including diverse issue. But as an immediate solution related to COVID, they need to see practitioners. They need to see professionally so that they can have professional help from the concerned body, because the context of diversity in Ethiopia is different from Uganda and different from the rest of the world. So they need to communicate professionally so that the problem can be easily solved. Thank you very much.
Thank you, Dr. Ephraim. And this question is directed to you again. It comes from Mustafa Ahmed. He says, how can psychological impacts of this pandemic be dealt within areas lived by poor people with no access to healthcare facilities, like families or groups of people with lower income in difficult areas where they have no access to healthcare facilities?
So what I'm thinking in the first place is the government should take its part, so that they need to address all the underprivileged community. So the question of health facility addressing vulnerable groups has to be intervened by the government. Unless and otherwise, the consequence will be fatal. Therefore, government need to undertake need assessment, need to conduct research, study, train professionals, and in a manner that can help the government to address the vulnerable group. So this time, the question of financial limitation, the question of physical, health facility limitation or scarcity of health facility limitation in a specific area could easily be addressed. So that the first point is government should intervene with this scenario so that they can help vulnerable group. direct involvement of the government. Government training individuals, equipping professionals with proper material skills and soft skills, and so that they can help them gradually. This is what I'm thinking. Unless and otherwise, the scenario become very much fatal.
Great. Thank you, Dr. Again. Second question has was not directed towards any particular person, but if Dr. Mokhtar can hear me, can you please answer this? The question comes from Zakaria Khair. He says the losses are not as bad as we have seen in other parts of the world, meaning like losses of COVID-19 here in Somaliland. What is the reason for that? Are we putting less of an effort or preparation from the government? I think that's what he means. Dr. Mukhtar,
yes, thank you. Thank you. Please, pardon me, could you please repeat the question?
Yes, no problem. The question comes from Zakaria Hargeysa. He says, the losses of COVID-19 are not as bad as we have seen in other parts of the world. What is the reason for that? And that's the main question. And he goes to say, are we putting less of an effort or preparation from the government?
Yeah, of course. This is not only in our country, but also in all Africa. According to the current literature reports, it seems the impact of COVID-19 is less heavier than Western societies, than Europe and America. This is the fact. This is also similar in our country, but this needs specifically in our country, in Somaliland, it needs research or detailed assessments should be done on to clarify cases dying due to complications of their medical conditions, might be cases of COVID-19. We don't know the exact figures. We are not tracing contacts. We are not checking everybody. So people are in doubt of increased death rates by the last 3 months. Actually, there is, this is significant in our country, but it can be, we can say that we are also lucky African peoples because the impact is less heavier, and this is obvious for African countries, and specifically in East Africa. Even if there are number of cases, but complications and number of deaths are a little bit lesser than other countries. And also regarding the impact, the way we have responded to COVID-19, I'm not satisfied as a clinician. Specifically, we've been, as I have mentioned earlier, we have focused on only the medical aspect. We have established an emergency unit, but we haven't trained people about psychological first aid. We haven't even helped frontline healthcare workers in terms of multiple dimensions. We haven't focused on fighting against myth and false information regarding COVID-19, which terrorize people, and so awareness raising, psychological, psychoeducation about COVID-19, as well as disseminating right information, as well as responding to people with COVID-19, as well as the community in a comprehensive approach. Social, psychological, and emotional well-being of an individual is important. So the way we have responded to COVID-19 is not strong enough, and we could not appreciate, and we do have many problems. Socioeconomic factors could be the implication. and also maybe a COVID-19 response team. So there are no psychiatrists or medical professionals engaged on those aspects. So there might be many reasons to be mentioned, but the way we have responded, the response was very slow, as well as it is not to the extent of very satisfactory. Thank you.
Thank you. Thank you, Dr. Mokhtar, and thank you to all of our participants for sending all your questions. Unfortunately, we have a lot more questions and we can't get to all of them due to time. But now I would like to call for last word from all of our panelists and including Dr. Jama as well. Yeah, of course, if any of our panelists have last words to say, and Dr. Drama included.
Should I start?
Yeah, of course.
Yeah, sorry, I was expecting. No, it was despite that we were having some internet connectivity problems, and I feel that people are writing us because it's a wide country problem. I think we had a good discussion, and we have some follow-up questions, people coming from our audience. So we will try to connect to the speakers and answer to these questions offline. I just want to thank really the team, Hargeysa Cultural Center, and particularly under the leadership of Tirsa, to putting together these 10 episodes, which was becoming a regular Wednesday meeting actually. And we will continue this conversation still for some time, but it could be as a permanent, and that's what I said last time, having the coronavirus was not all a problem, but there was also the fact that we discovered that we have an opportunity extra to explore, to reach out to more people. So we will continue this conversation online and via webinars, while of course the Hargeysa Cultural Center physical activities is restarting starting from this week. So I just want to thank the real contribution that our speakers covered, and I thank all you, also Khadan, for the wonderful moderation that you have done. From me, take back the microphone.
Thank you, Dr. Drama. And you don't have to, but any last words from all the other panelists? And if not, then Tirsa can take over.
Thank you very much, Kadan, but I still want to give back to the participants, and can Assistant Professor Ephraim start, and all of you can have your last words.
Right.
Unmute yourself.
Thank you. Last word, I don't want to say much, but what I'm thinking and feeling is everybody needs to contribute what is expected of him or her professionally. We have a moral obligation, we have a professional obligation. Without expecting much from the government or from the concerned body, I'm thinking that everybody needs to contribute without expecting. So we have a professional obligation. And again, as we are working in the same domain, therefore, we need to contribute professionally, morally, we are obliged. We need to help those who need help. And therefore, this is a time which is different from the time that we have experienced it before. Therefore, this is what I'm actually thinking. Thank you so much.
Thank you very much. Dr. Maria?
And I'm really thankful and glad that I took part in the panel discussion. I'm thankful for that. And I would like to thank you, both of you, especially Hargeysa Cultural Center, by providing these sessions. And I would like to thank Dr. Musa Chama, Dr. Libal, Dr. April, Dr. Mukhtar, and our lovely moderator, Qadan, and for sure that's communicating with us. And my last word will be coping mechanisms are crucial, and everyone is important to look after his or her own mental health. So yeah, thank you for having me.
Dr. Liban? Unmute, please.
Do you hear me now? Okay, and I am especially thanking for Hargeysa Cultural Center, which I have been following for a long time about their researches, about their libraries, and their discussions. And it was a good opportunity for me to invite on this episode. And I am saying you are doing a good job. Please continue. And specifically, mental issue is a neglected and stigmatized area. If you provide an opportunity to discuss more, and not only on this COVID-19, but in general, how the psychiatric and mental illness is, so that to get people the right information and awareness raising is very much important. And my last word is on this, on today's panel, is that the coronavirus disease is still with us. We have to follow up the guidelines designed by the government to avoid the infections. And we have to be careful and be helpful for the psychological well-being of our society. Thank you very much, all.
So thank you very much, everyone. I don't see Dr. Mukhtar, but we really are grateful, as Dr. Jama said, bringing together this panel was a group work, and you guys have delivered to our expectation. And I really want to say thank you very much on behalf of the Hargeysa Cultural Center and all the team members. Thank you very much, Karan, also for the very excellent moderation that you had done today. And thank you very much, everyone who has followed us through the social media, on Facebook, and also those of you who have been sending questions in the question and answer session. And as Dr. Mukhtar said, even though we haven't been covering the psychological impact of it, we have the 10 episodes covering on the social, economical, on a lot of layers of COVID pandemic, but definitely also related issues of mental health, which we are not saying we had enough, but we will definitely want to capitalize and work on them by using resourceful people like you guys. So really thank you very much. And next week, God willing, we're going to be having our 11th episode that we are going to be focusing on the justice and how justice have been affected by the coronavirus. So that will be the next episode coming. Thank you very much, everyone. Have a blessed evening.
Thank you.